Hey there folks, if you're experiencing erectile dysfunction or ED, you're not alone. It's a common issue for many older men, but the good news is, there are effective treatments out there. In this video, I'll guide you through some of the best ways to tackle ED and get your confidence back. First up, let's talk lifestyle changes. Making healthier choices can work wonders. Start by eating a balanced diet. Lean proteins, whole grains, and plenty of fruits and vegetables can help. Regular physical exercise is also key. Aim for at least 30 minutes a day, whether it's brisk walking, swimming, or even gardening. If you're carrying extra weight, losing it can make a big difference. And of course, quitting smoking and cutting back on alcohol are crucial steps. Managing underlying health conditions like high blood pressure or diabetes is equally important. And don't forget to prioritize good sleep habits. Now let's address the elephant in the room: sexual desire. A 2020 review found that a staggering 82.4% of men aged 80 and above report a lack of sexual desire. This can directly impact ED. Seeing a sex therapist can be a game changer, helping to rekindle that spark and reduce ED symptoms. Moving on to medications. Doctors often prescribe medications alongside lifestyle changes. One of the most common options is phosphodiesterase 5 inhibitors, or PDE5 inhibitors. These work by relaxing and widening the blood vessels in the penis, improving blood flow. Some well-known PDE5 inhibitors include sildenafil, aka Viagra, tadalafil, known as Cialis, avanafil, and vardenafil. According to a 2017 review, these medications are generally safe for older adults, even those with cardiovascular issues. However, if you're on nitrates for heart conditions, steer clear of these. Another option is testosterone replacement therapy, or TRT. If your testosterone levels are low, TRT can help. This involves regular testosterone via injections, gel, or a skin patch. But remember, TRT won't address issues like reduced blood flow or nerve damage, which are common causes of ED in older men. So there you have it, a comprehensive guide to treating ED in older men. Remember, it's all about combining lifestyle changes with the right medications. Don't hesitate to talk to your doctor about the best options for you. Thanks for watching, and take care.